Good afternoon, Conference Chair, Christina McAnea, General Secretary, and delighted to be here with you all in Bournemouth. And I want to start by thanking Wilma, Maura and Tanya, the chairing team, and indeed the whole executive for all the work that they do throughout the year on behalf of members and for the leadership they've shown, especially during what can often be difficult and challenging times. And as Wilma did earlier, I also want to thank, and she's just walking across the room now as I speak, I also want to thank the lovely Ros Norman, the former chair of the Health Committee, for all her work and leadership over many years, and her personal friendship with me means a lot. And of course, a huge thank you to Sarah and Helga and the entire health team, the national and regional staff, for the work they've done for our health members throughout this dispute, in running the ballot and, of course, during the negotiations. But most of all, I want to thank all of you in this room and all of the health activists for all the work that you do day in and day out, supporting members in your branches. And I know that takes a lot of time and effort, and I'm deeply grateful to you for the fact that you've given your time to this union. And it's been a tough year in the NHS, across all parts of the UK. The longest waiting times on record, the highest levels of dissatisfaction with the NHS, the highest levels of vacancies in the NHS. But you've done such a fantastic job in the face of all these issues, so much so that when it mattered during the dispute, the public and most of the media, I won't say all, didn't blame you. They put the blame squarely where it was meant to be, with the government in Westminster. And what a year it's been for our members. The negotiations in Scotland, the threats of industrial action, weeks of pay negotiations, all led by our very own Wilma Brown, and resulting in a deal that delivered pay increases of between £3,700 and £6,500 plus a lump sum. In England, Wales and Northern Ireland, we had the paltry offer of the £1,400 from the peer review body. And we warned the government last August and July that £1,400 just wasn't enough, that a dispute would be inevitable if they stuck to that. That it wasn't enough, it didn't even touch the sides of what people were going through in terms of a cost of living crisis. And we told them again when this award was rejected by our members. We warned them it would lead to strike action. But still, the Tories in Westminster refused to talk to us. They refused to get a grip on the crisis in the NHS and on the pay crisis affecting so many families in the UK. And so the strikes began, our strikes began in December. And we started the strike with mandates in 8 employers: Liverpool University Hospital Trust and Liverpool Heart and Chest, NICE, London Ambulance, North East Ambulance, North West Ambulance, South West Ambulance, and of course Yorkshire Ambulance. Now, we would have liked to have seen many more branches getting over the 50% threshold, but with so many branches getting over 40%, it was clear how much work you had done in getting that turnout. Getting the vote out, I saw this for myself when I was visiting ambulance stations and hospitals, and our regional organisers were supporting branches to campaign, and our staff at head office who set up and rolled out our new movement system. 250,000 calls were made in that system during this dispute. Now, we know the law in England, Wales and Scotland is designed to make life difficult for us. We have to send out ballots by post to members' home address. We need 50% of them to fill in the ballot paper, put it back in the envelope, send it back to us. It sounds relatively simple, but of course it's not. People have got busy lives and these things are often forgotten. And we shouldn't beat ourselves up about this. Our overall turnover was 33%, the highest we've ever had in this sector. So yes, you did a brilliant job at getting members to vote. You did a fantastic job at getting them to send those ballot papers back. And even where you didn't take strike action, I know that the support you gave to your colleagues who were on strike was amazing and was really appreciated. And I say this to everyone who can't bring themselves to be positive about our union's work. Don't talk down our efforts. Look at what those 8 branches achieved. The publicity, the media coverage, the public support, and eventually the negotiations. And when we targeted those employers with the next highest turnout, we got 10 out of the 11 over the line. Tavistock and Portman Trust, Bridgewater Community, Great Ormond Street, Liverpool Women's Hospital, NHS Blood and Transplant, East of England Ambulance, East Midlands Ambulance, South Coast Ambulance, and West Midlands Ambulance. And all of these helped to show the government just how serious we were about this and piled the pressure on this government. We were prepared to bring out almost the entire ambulance service across England, Wales, and Northern Ireland. Bringing out blood and transplant and other specialist hospitals and services again put huge pressure on the government. It showed the strength of feeling. And what happened after that second ballot? Days after it, the government finally said they would talk to us, and more importantly than that, they agreed to put more money on the table. That's what was achieved by that strike. Now, some will tell you that you didn't achieve this, that it was actually all the other unions that got it. Well, of course we work with other unions. We've always worked with other unions in the health service. And it was great that we were all part of the strike together where that happened. And in the ambulance sector, I was talking regularly with the General Secretaries of Unite and GMB, and I was also talking with the General Secretary of the RCN. Now, I appreciate that each union will do what it has to do in the best interest of its members. But in UNISON, we believe in solidarity. We could have done a side deal. We could have had separate talks. But we didn't, because we believe in collective action. But more than that, the reason we need to do right by every single person who works in the NHS, regardless of what job they do, is because every single patient needs all of those staff. Because, Conference, if it takes a village to raise a child, we know it takes a whole team to treat a patient. I know we're still in talks in Northern Ireland and Wales, and in Wales in particular, following the result of the Welsh ambulance ballot, negotiations are going on. They're due to finish this week. And UNISON has been at the heart of those negotiations, leading on them with other trade unions, of course. And what can I say? Northern Ireland, I don't know where you're sitting. I mean, seriously, what a campaign. No government to negotiate with. Employers who can't take a decision, and yet you still manage to run a fantastic campaign and get great public support for it. I spoke at a really big rally in Belfast in February, and the mood and the support was just fantastic. But you have now forced the Secretary of State to talk to you, to talk about improving pay in Northern Ireland, and that is a fantastic achievement. You've shown the power of UNISON, the power of solidarity and collective action. And as well as going to Belfast, I visited picket lines right across, well, mainly England, I have to say, from Sheffield to Soundwell in the southwest, From Waterloo in London to Windy Nook in Gateshead, and it was windy. Well named. With many stops in between. And it was a huge privilege to me to be able to go out there and meet activists and to see firsthand not only your commitment to the job that you do, but your commitment and determination to see this fight through to the end. We got great media coverage. And when you think we had relatively small numbers out on strike, and I want to thank our press team for that. Liz Chinchin, who's our head of media, has got a relatively small team for such a big union, as she's always telling me. But they managed to ensure that we were plastered across every TV, every media outlet, every radio station, and most of the newspaper. Every paper that I picked up when we were having strike actions, we were plastered across it. But above all, the best part for me was hearing your voices on the media, telling your stories and explaining why you were on strike, explaining why this was so important, that you were doing it, yes, for pay, but you were also doing it for patients. You were doing it to improve the NHS. And we got a deal significantly better than the £1,400 that we got from the PRB. And I mean significantly better. Is it the best deal ever? No, of course not. Do you deserve more? Absolutely, you deserve more. But this is a deal which will put more money into people's pay packets. And remember, our members have voted decisively to accept this. Now, I've heard some people say that 53% is not a high enough turnout. Well, you know what, Conference? If we got 53% in an industrial action ballot, I doubt we'd hesitate to bring people out on strike on that. But I'm also picking up this kind of, oh, well, your members, isn't it because they're all low paid and that's why they've picked up this offer? And do you know what, Conference? Don't let anyone patronise our members. Because you know what we did as a union? We gave them full information. We didn't hide anything. We didn't sugarcoat it. We told them exactly what had been told to us. They read it, they understood it, and they made up their own mind. And yes, many of our members are low paid. But that doesn't mean they didn't understand what was going on. It didn't mean they couldn't read the information and make up their own mind. And that's what you tell people who tell you our members didn't know what was going on. Now, at the moment, we know the RCN have rejected the offer, but we won't know until May what's the position with all the other health unions. But let me say this. We will hold that government to account to deliver that pay offer that we took strike action for, that you took strike action for, and that we got put on the table. And you know what? Even the RCN are saying to the government, don't take that offer off the table. So we will be holding them to account for that. Conference, it's been a really busy year for us for industrial action in UNISON. Last year, I went around loads of conferences and I called on all parts of our union to get strike ready because we could all see what was coming down the road. We put more resources into our ballots. We've found smarter ways to increase our turnout, and it's beginning to show dividends. Our members in the Environment Agency have been on strike all weekend. They just finished at 7. They started 7 o'clock on Friday night, finished at 7 o'clock this morning, over a 2.75% pay offer. Strikes in higher education are still ongoing, and now our members in the Care Quality Commission, the CQC, are working to rule. And we've got many local disputes up and down across the UK, and we're preparing for a ballot in local government. And these fights will continue until we see proper investment in public services and public sector pay. But strikes are just one way that we get more money for our members. We've also had the brilliant Earnings Max campaign that you've all been participating in. And through the work that you've done in your branches across the UK, we have now put £150 million into people's back pay. That is a huge figure in terms of what people are achieving, and branches around here will know what that meant to those individuals. Just on the rebanding claims alone, in Newcastle, Northern Carolines, Tameside, Bristol, Leeds, in fact, too many, you'll be glad to know, for me to stand here and list off. But we have 59 live pay fair campaigns across all parts of our unions, across every region. And over the next years, these campaigns will be expanding. And we've had some great successes on insourcing. We've had Lanarkshire Health, Pennine Care, Liverpool Hospitals, and at lunchtime, the branch secretary from North Middlesex just come up to told me they'd just won a big insourcing campaign they've been running for a year. All wins achieved through campaigns and negotiations in workplaces all across the country. And I tell you this, under my leadership, UNISON will continue to battle on these issues and will continue to support these campaigns. Now, I want to talk about something really important that's happening in our union this week. Today is the start of our NEC elections. Don't groan. Don't want to hear anybody. They are really important. Ballot papers are being sent out from today to people's home addresses, because it's like pay ballot, has to be a paper ballot sent to people's home addresses. And we're asking members to vote on a new leadership team for the union. Every 2 years we do this. And just as it was important that you got your members out to vote in the industrial action ballot or to vote on the pay offer, it's equally as important that we get them to turn out the vote in these NEC elections. The NEC will be working with me over the next few years to face all the challenges that we know are coming down the road. So when that voting pack drops through your door, you'll notice that you have more than one vote. I'm sure most of you here will know that anyway. But it's really important that you and your members have a say in who will represent you from your region and who will represent you from your service group. And for you, obviously, that's the health service group. And everyone gets a vote in who the disabled members and the black members' reps will be on our NEC. So please use your votes. Turn the vote out in your branch. Let members know what your branch's position is, because members' voices need to be heard. And we know members trust you. They trust the branches. So please get your message out to them about turning out the vote. Conference, I'm really proud. I've said it before, but it's true. I'm very proud to be UNISON's General Secretary. It's had its good times, it's had its tough times. But I'm proud that we're a union that doesn't just talk to its members. We listen to our members. We give them information. We hear what they tell us. We respect their judgment and we respect their decisions. And people join us for many reasons and stay because we're a fighting, campaigning union. They stay also because of the support they get when things go wrong. And they stay because we're visible in workplaces and we have great reps in workplaces that they can turn to when something's gone wrong. And I think they also stay because we put equalities at the heart of everything that we do. Now, this is the year, as you know, the year of black workers, UNISON's year of black workers, and I am absolutely determined that we grow a legacy from this that will have a lasting impact on our black members in UNISON. This is not just for 1 year. This is something we will grow this year and build on for years to come. I also like to think members join us because I think we're an honourable union. We support other unions. We support campaigns and causes outside of the union movement. We support public services and workers in other countries that are facing attacks, like Palestine, Colombia, Turkey, and Ukraine. And at home, we campaign on many issues, and the recent one we've just been doing a lot of work on is the National Care Service. Our main focus is the workforce, but a National Care Service will benefit everyone in society. We launched Let's Make Care Work, our campaign for a national service, earlier this month. We want one that's focused on providing first-class services, not profits for shareholders out in some obscure island, tax-free island. We want one that's got proper pay and conditions for staff. And we know the lack of care services has a huge impact on the NHS and the jobs that you do. That's what UNISON is about. Improving working lives everywhere, doing what's right for a fair and just society, and non-stop campaigning for decent public services for all. I love coming to this conference. I was head of health for quite a few years, and I see many faces, many old friends when I come to this conference. But remember this, what you do matters to every single person in this country, and what you do matters in our union. You are now at the centre of the biggest political debate in this country. The NHS and what you do is at the heart of that debate at the moment. So you need to make sure that you are at the heart and centre of taking decisions about UNISON, our great union, will do next, and continuing that campaign for decent public services and decent pay and conditions. I hope you enjoy the rest of your conference. Thank you.